I'm Des Walker, sports therapist. I'd just like to say thank you to the League Football Education for inviting me to discuss the intrinsic and extrinsic factors in professional football. In a physically demanding and competitive sport like football, injuries are inevitable. However, there are things that you and your club can do to make it less likely. In the past, football care was more concerned with diagnosing and treating rather than preventing. Now we know that once an injury starts to surface, this is too late. Therefore, injuries are prevented by taking appropriate intrinsic and extrinsic factors in conjunction with the following: your club physiotherapist, your strength and conditioning staff, nutritionist, sports psychologists, and academy teachers. An intrinsic factor in the physical aspect of your body that can cause injury, for example, poor warm-up, poor cool-down, lack of sleep, poor nutrition and hydration, lack of fitness, not following rehab protocols, inappropriate clothing, too hot or too cold, for example. An extrinsic factor are factors of the environment where you are playing. For example, appropriate surfaces, e.g. grass rather than 4G, poor choice of footwear, incorrect treatment of biomechanical abnormalities, for example, pronation of the foot, which would require podiatrist intervention, poor rehab protocols, inappropriate training, for example, too much too soon, inappropriate coaching, air pollution affecting players, for example, creating respiratory distress, inappropriate techniques, the crowd, and finally, muscle imbalances. Okay, so we're going to test for muscle imbalances within the shoulder. What you find with professional football is usually the players that throw the ball, or if you fall on the outstretched hand, it causes the injury to the shoulder. So this is how we find these muscular imbalances. Okay, so I'm going to take the patient's arm and ask him to take it into flexion and to push back as hard as he can, and I'm going to try and overcome him. So if you push back, okay, 1, 2, 3. So here I'm just testing the deltoid muscle and relax. Okay, so next movement is we're going to take the shoulder out into abduction. So we're going to be testing the supraspinatus muscle. So if you're just going to press your arm, bring it in towards the body as hard as you can, and again I'm going to try and overcome him. Excellent, and relax. Okay, so next we're going to be testing external rotation. This is for the infraspinatus muscle. So we're just going to take the arm out. Again, he's just going to push the arm down to the floor, and I'm going to try and overcome him. We're just testing for any weaknesses or pain within the shoulder at this point. Okay, and relax. Okay, so next we're going to go into internal rotation, testing the subscapularis muscle. So bringing the arm out, and again, he's going to bring it down to he's going to raise his arm up as I press down to the ground. 1, 2, 3, and relax. Okay, so we're going to go into internal rotation, so testing pec major. So we're just going to twist the arm, and we're going to pull the arm into the midline of the body. 1, 2, 3, and relax. So you have a rotation of the humerus with that movement. So the last muscle that we're going to test is going to be the lat dorsi. So again, we just take the humerus into internal rotation. We're going to adduct the arm towards the midline of the body and resist. Again, just looking for pain or any weaknesses that are presenting within the shoulder.